Expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home health care agency. We are servicing Miami-Dade, Broward, and Palm Beach County. You can reach us directly at 954-717-7027. I am your host, Louise Gomez. Welcome to the show, everybody. And today I am excited to introduce everybody to Dr. Monica.Atkinson. And you can reach her directly at 561-202-3155. And her website is www.medexpertfl.com. Thank you so much for joining us today, Dr. Atkinson.
Thank you for having me. Good evening.
Absolutely.
Nice to be here. Yeah. It's an honor.
Thank you
really
so
happy.
much. So, Dr. Atkinson, I've been reading a little bit about you, and I know I believe you're in the who's who of Florida directory, so that was exciting to learn about you a little bit. So I want to share with everybody a little bit. I usually like to ask, what is your, where did you go to school? What is your educational background?
So I went to medical school in Romania, and when I graduated, I moved here, went to residency in New Jersey, finished their family medicine residency, and I worked as a family doctor for 20 years in New Jersey before I decided to move here to Florida in 2023. So I'm pretty new to the area.
Oh, okay, yeah, a couple of years.
Yes.
So it's funny because Romania, I think we were talking before the show, you mentioned something about Transylvania.
Actually, yes, that's in season. I thought is very appropriate because I am indeed born in Transylvania, raised in Transylvania. I went to medical school in Transylvania, and a lot of people may think vampires and cemeteries and things like that. I actually grew up in a very cosmopolitan city in the center of the country. But I did hear all the vampire jokes
I'm sure you did.
throughout my residency and my stay here, so I thought that was funny.
Yes, it is. So, Dr. Atkinson, I know you were in New Jersey. What, you were in primary care as well?
Correct. Yes. Primary care, outpatient, family medicine. I was also involved with teaching, and I love that part of the medicine is academics and teaching medical students. I'm actually an assistant professor with Cooper Medical School in New Jersey.
Very good.
And I taught generations of students there. It's a very competitive medical school, so I was proud to be part of that. But the main area of expertise would be patient care. In New Jersey, I had a large panel of patients with neurodevelopmental disabilities, nonverbal patients. Somehow I was considered the neurodevelopmental doctor. I was the horse whisperer because this patient responded somehow to me very well.
Well, you have a special gift and talent that you can't study that. That's innate. I feel like that is a gift.
Thank you. That was I really love doing that part. Actually, we had so many patients in our practice that became a pilot program for New Jersey legislation, how to improve protocols around the care of these populations, because there was nothing done for 20, 30 years.
Sure.
And things change, and
Sure.
how to decrease the wait time, how to keep them occupied, how to prevent outbursts, things like that. So we did a
Amazing.
lot of education with our staff and with medical school about that. So it was really amazing.
It's so good for you to be able to share your gifts, talents, and abilities, especially in that population where, people can get frustrated with them, and it's not an easy population to work with. So
It's true. Most people from outside may think that way, but once you're inside, behind behind the curtains, is actually an easier population, because if they live in a controlled environment, like an assisted living facility, or they usually, if the doctor who overviews their care is very involved, then they can be like, they will take their vitamin D every day. If that's on there. They will put a sunscreen every time, because they have the team. So they really do need a strong team to do very well, and a good coordinator of that team. And if you care and you put those things in place, then they actually do very well.
Are you involved here in South Florida in the neurodivergent community?
Not yet.
Not yet? Okay.
In the future, maybe.
Maybe.
I just opened a private practice. It's called Med.Expert.
Okay.
It's a concierge family medicine, private practice, family medicine.
Where are you located? You're right here in Boca?
I'm here in Boca, by the West Boca Regional Medical Center.
Oh, perfect.
Okay,
Yes, I know where that is.
Very close to here, in one of the Arts Pavilion buildings. And I have this beautiful hotel-like looking type of office, and I'm brand new to the area. 2 weeks ago, we just opened the doors 2-3 weeks ago, so we are welcoming new patients. Anybody who needs a family doctor, they are more than welcome to come. And
what ages are you seeing?
I'm seeing 12 and up.
Okay.
So for now,
Okay.
I as a family doctor, we are trained to see 0 to 100 or above, but just for now, 12 and up patients. And what prompted me to open the practice was the fact, I feel like my whole life I prepare for this moment. It's kind of a culmination of what I always wanted to have my own practice to.
Lovely.
But when I moved here to Florida 2023, I worked for a large company, and it made me sad to see that patients expect very little of their family doctor. They are used to expect very little. They are used to just expect a referral, and that's it.
And you go deeper.
They don't have time. The way the appointments are made, like every 15 minutes, and everything is so protocolar, like it has to follow a script almost. There is no time for any kind of personal connections or personal care, which I believe it's healing.
That's what we want.
It's healing on itself,
That's
right?
That's what we want.
I'm really trying to offer that in my new practice, and anybody who's looking for a doctor who listens to them and takes their time and gets personalized care, non-protocolar care, they are welcome to contact us to come and become our patients and visit us, maybe just for a meet and greet, complimentary meet and greet, and sit down, and we can find out what I can do for them.
So you have a couple of things in your office that kind of set you apart from a traditional primary care physician, I was reading. Do you want to share with us some of the treatments and different modalities that you do?
Sure. So besides doing everything that a family doctor or a generalist do, like physicals, clearance for surgeries, We also have some, it's very sought after in the community, wants to step a little bit outside of the box of traditional medicine, and people like to get more support in their care from IV vitamins, for example. So I offer
Nice.
few different cocktails.
Nice.
Besides Myers cocktail is the most known one for
Sure.
recovery from dehydration and tiredness. We also have boost and performance recovery and performance for athletes.
Nice.
I'm very much involved with tennis community. My daughter is a high intensity, high performance junior tennis player with Chris Everett Academy. So,
Good for you.
so I know how tired and
Yeah.
how hard and what it means to go into to travel to a tournament, to come from a tournament,
sure.
win or loss. We have this kind of IV kits specialized for the athletes, and then different recipes. Some we use for migraine headaches.
Oh.
Some we can use for just being tired. I know there are formulation out there for if you went to a party and you need
the
hangover
yeah,
fix. We can provide that too. So
I swear by those, by the way.
you've tried those, really?
Oh, I've been doing those as soon as I feel like, something's going south here. I go
And you feel like a reset, a reboot.
complete.
It's not a miracle fix for anything,
Oh,
but it can shorten your illness
Yes.
if you're dragging after a cold, or if you're gonna travel, for example, to a wedding and you know somewhere overseas, and you have a long ride, airports, wait time, and all
Yep.
that, and you want to get the best protection you can possibly have, you get a immune boost
Yes.
vitamin. So I think they work for the short
definitely.
duration like that.
Yeah.
And we offer the lowest prices on the market right now,
good.
just because it's October. We have a promotion I just opened.
Okay, let me give your address again
Yes.
because we want people
Yeah.
to go there.
Thank you.
Oh, I have the website. You can call her at 561-202-3155, and the website is www.medexpertfl.com. And after the commercial break, I'll get your address, and we'll tell everybody the address
Perfect.
again.
Thank
Yeah,
you.
of
Yes.
course.
Yes.
So yeah, you have different cocktails. And what else do you offer? I know you offer a couple of other things.
Yes, so I have this machine. It's amazing. It's looks like a tall robot, like a lamp. It has an ultrasound head. It has these sensors where patient holds onto the handles, and also sensors for the feet. So
Okay.
you gotta take
Yeah.
your socks off when you do this measurement. It uses bioimpedance. So bioimpedance is a kind of a medical and from physics kind of word, where a small electrical wave will go through your body from left to right, from arms to the legs, and measures the resistance that that electricity is hitting. Like your muscles will show a different resistance versus how your adipose tissue or the fat tissue, and how the water, and so it gives you about 20 parameters, analyzes
that's good.
the percentage of total water in your body, the water that's in your veins and blood vessels, the water that's outside, and it's kind of when you feel bloated and all that. So it kind of gives a lot of indexes to quantify hydration, because we always say, oh, I feel dehydrated, but how do you measure the dehydration?
We have a quick commercial break. When we come back, we're going to
Yes.
continue talking about that device.
Sounds great.
Absolutely. We'll
Thank
be
you.
right back, everybody.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Yes.
That's cool.
Hi, everybody. Thank you for tuning back in. We are interviewing Dr. Monica.Atkinson. You can reach her at 561-202-3155. And her address is 9960 Central Park Boulevard, Suite 225, Boca Raton 33428. You said that's right near Boca West, right?
Yes, Boca West Regional
Regional,
Hospital. Yes.
So, Dr. Atkinson, we were discussing this amazing device. It has these quantitative measures where you can actually see your progression, I guess, as you gain more muscle mass, right?
Yes, it has a lot of different applications. In the athlete world, for example, if an athlete has an injury and they are not able to use their right arm because of, let's say, a right elbow injury, and they start losing muscle mass. As you know, these high performance athletes, they train every day. My daughter puts in 5 hours of tennis a day. So there's a lot of overuse injury in that population. And then you want to quantify their progress. They go into physical therapy, they go into the gym, they want to go back. So they want to have a baseline measurement to see how they are before the intervention and after intervention. So this scanner shows right versus left arm, right versus left leg.
Nice.
So it's very detailed. There are a lot of similar machines like this in gyms, where it gives you kind of like the muscle mass, the fat mass. This is kind of the step up the medical grade one, where you also get the how much fat is around the organs, which can be an indicator for how much risk one can have a cardiac risk. So you can apply it that way. And we were talking about hydration. We live in South Florida, right? And people say, I feel dehydrated, I'm going to go and have an IV fluid. Well, I took it a step further. I said, well, how dehydrated are you? Are you really dehydrated? Because you said you drink 3-4 bottles of water, so let's measure. So this machine actually can give you a quantification, so to speak, of, how much water is in your veins, how much water is kind of leaking in your legs and gives you swollen legs, and how much you need to get into kind of balance it all out. So I thought it's a good idea to tell people, I'm not just going to give you an IV fluid. Let's see if you really need it. So let's make it even more realistic.
What I love about that, using these types of modalities in an office, for me as a patient, I love to be able to see it. Oh wow, okay, X percentage of body fat or visceral or
I did my own scan. And
Yeah.
that triggered me to be like, okay, I'm going to scan today and in 1 month.
That's what I mean.
And then it's just kind of like,
Yeah.
okay, this is working.
That's
Or-
why I
yeah.
think we like that, because we're like, okay, I got to do something about it, and you actually have
a goal to work towards, absolutely.
Yes. So
and motivation to work towards that goal, because you know you're gonna get scanned again, you want to see results. So
absolutely.
it's a kind of a more objective way. You know, you can also go with a old-fashioned, well, let me see if these jeans will fit me or not. But
I
you
get it,
you
yeah.
get the details of
Sure.
it. So.
And you have a couple of other things that set you apart.
So we also do some genetic testing.
Oh.
A lot of people wanted
Tell us
to.
about that.
It's very new. We kind of became part of. Well, we contracted somehow. It's not a contract. It's kind of associated rather with Natera, which is a well-known firm that offers genetic testing. They have again different protocols, and if you want to test 40 genes versus 80 genes versus 95 genes, and it's a way for people who want to screen for familial cancers.
Okay.
Like, let's say one may have 3-4 cancers in their family history, an uncle and a grandfather and this and that, to kind of see what are the chances, what is the percentage, some people don't want to know that, right?
yeah.
Like I don't know if I would want to know that, and what are the implications of knowing that. So there's a lot of ethical and moral things around the subject, but in our days, I feel people want to know more. More is better. Information is power, and that's usually the truth.
And now, if somebody gets genetic testing, are they able to tell if certain medications will be effective for them because maybe they don't metabolize that or methylate that? So does that help with medication prescribing?
That's a little bit different. There's a branch of genetics that checks which medication is best.
Right.
Okay.
Yeah.
This is a little bit different. It tests for cancer genes. So let's say a person tests positive for familial breast cancer, let's say, and they don't currently have breast cancer, but they have, say, 14% higher chance than the rest of the population to.
Does it show?
So
it would show
it
that?
It would show the
percentage?
or the likelihood, or how many genes or how strong these genes are connected. So once you find out that information, you can make some changes. You can be proactive. Like, I want to make sure I'm not going to miss my mammograms every year. Your doctor may tell you, well, maybe you should have mammograms every 6 months, or change the protocol that's in general population and adapt it to your higher risk factors. Certain cancers, like, say, bladder cancer, right? If some people test positive for a gene connected with bladder cancer or colorectal cancer. For example, colorectal is #1 cancer in the population.
Wow, I didn't realize that.
Then they will say, well, I'll make sure I have my colonoscopy. And the Cologuard is not going to be enough. I need to have the real thing, the colonoscopy. Or they will say, well, I'll avoid every smoked meat because there is a chance that smoked meat and to be connected to. So they will modify either their diets, their screening protocols, you know. They will consider testing other family members. And they will also be in touch with a genetic counselor. Because by any means, I'm not a genetic counselor. I'm a family doctor. I'm kind of like open the door to where you should possibly take your next steps in the care.
And I like how you're offering options. Like, this is an option for people who maybe some people won't want it, but the ones that do, this could be very valuable information for them.
sure.
Information
Yeah.
is power, right? Once we have
Information is
that.
power, then you decide how to handle it. Like, you can have few options on how to handle that information.
Right, right. And so what else in the practice? Do you talk about lifestyle? What else sets you apart?
So what I think I want to achieve, all these years since I've been practicing, about 20 years, I absorbed the most common complaints that the patients have when it comes to healthcare system. And they are probably in this order. Every time I go to the doctor, there's another doctor. I don't never connect with one. It's a big turnover. And that's usually part of the bigger systems problem that is difficult to control. There's a lot of turnover. Secondly, doctor doesn't have time for me.
Yeah, that's a big one.
That's a big one,
Yeah.
right? So I want to sit down, I want to listen to the patient, I want to understand where they are coming from, try to get to the root of the problem rather than impose my own agenda, my own protocol, or rather the insurance protocol or the company's protocol. We don't have to do that in my practice. It's just you and me, right?
Exactly.
Having that conversation. Another things that patients dislike, another thing that patient might dislike would be, no, there is no follow-up. I got my test, nobody called me.
Oh, that is another big one. Yeah.
Yes, so I'm gonna have alarm systems in my office where, I just had a couple of patients coming for preoperative clearance, few of them actually, because it's sometimes these preoperative clearances, they need to be done 30 days before a surgery.
Okay.
So it's sometimes difficult to get into your doctor, have all the tests done, have all the evaluation done, and be ready for the surgery. So I have quite a few of those. And
Nice.
I was happy to see, like, even the labs that I work with, that contract with, the next day I had labs. We did EKG in the
nice.
office.
So you got
chest X-ray
got
was
it done
done.
right
From
away.
almost like in 2 days we have everything done, and we were able to clear those patients for
Very good.
surgery. So
Dr. Atkinson, it's been almost, the time has come. It's been amazing. I
you
do
for
want to
having
give,
me.
absolutely, I want to
That's
give your
great.
phone number again, 561-202-3155, and www.medexpertfl.com. Any last words you want to give to the audience? Please share.
thank you so much for having me here. I'll wait for you at my office, and you will not look for another office or another doctor once you step into our space.
Sure, absolutely. Look
Have
forward
a
to
great
that.
evening. Thank
Have a
you
great
so
evening,
much.
everybody. Take
Thank you.
care.